You know that sudden, sharp pain in your stomach? Well, for a doctor, that kicks off some of the most intense detective work in all of medicine. So today, we're going to go behind the scenes of that high-stakes investigation and see exactly how doctors crack the case.
I mean, we've all been there, right? You get that sudden, out-of-nowhere pain in your gut, and you start wondering, is this just some bad takeout, or is this something actually serious? But for a doctor, that exact question is what starts the clock ticking on a high-stakes mystery.
All right, so first up, let's kind of set the scene for this whole investigation. Because we're not talking about just any old mystery here. This is an incredibly common one. But the stakes? They can range from, a minor annoyance to a full-blown, life-threatening emergency.
And here's what's so wild. The vast majority of these cases, we're talking over 90%, they don't end up needing surgery. But see, the doctor's job isn't to find the 90%. Their number one job is to hunt down that dangerous minority, that small percentage that does.
And that dangerous group of cases, it actually has a name. Doctors call it the acute abdomen. Now, this isn't just, a bad stomachache. It's a very specific medical term that means there are clear signs of serious trouble inside, like the lining of your abdomen is getting irritated. This, right here, is the prime suspect our detective is laser-focused on finding.
So, where does an investigation like this even begin? Well, it starts with the victim itself, the pain. A doctor's first move is to basically interrogate the pain, to listen super carefully to the story it's telling. Because believe me, different kinds of pain offer up totally different clues.
And this breaks it down perfectly. You can think of it like there are two main languages that abdominal pain speaks. First, there's visceral pain. You know that feeling? It's dull, achy, kind of crampy, and you can't really point to exactly where it is. It's just in the middle. That's usually an organ stretching or spasming. Then you've got somatic pain, and this is the complete opposite. It's sharp, it's constant, and you can literally point with one finger and say it hurts right here. And that's a huge clue that the lining of the abdomen itself is inflamed, which is, well, a much more serious sign.
Okay, but then things can get tricky. There's this thing called referred pain, and it's like a phantom clue that can totally throw you off the scent. This is where you feel pain in a place that's nowhere near the actual problem. A classic example, something irritating your diaphragm way down in your abdomen can actually show up as pain in your shoulder. It's wild. A good detective has to know not to get fooled by these red herrings.
All right, so armed with these first few clues about the pain itself, our detective now starts the real on-the-ground investigation. This means gathering testimony, that's the patient history, and physically examining the scene of the crime, which is, of course, the abdomen.
And make no mistake, this is not a random chat. It is a systematic interrogation, a checklist of crucial questions. They're going to ask, when did it start? Was it a sudden explosion of pain, or did it build up slowly? Where does it hurt right now, and has that spot moved? Can you describe it? Is it sharp, dull, crampy? What about other things, like a fever or vomiting? And a big one, does anything make it better or worse? Every single answer is a vital piece of evidence.
Now, while they're asking all these questions and doing the physical exam, the doctor is also on high alert for what we call red flags. These are the clues that instantly escalate the whole case. We're talking about things like a sudden thunderclap pain that hits you out of nowhere, or if the abdomen is rigid and hard as a board, or if there's signs of shock, like low blood pressure. Any of these means the investigation just went from code orange to code red.
So once they've gathered all this initial evidence, a doctor doesn't just jump to one conclusion. That's not how it works. Instead, they build something called a differential diagnosis. You can think of it like a list of suspects, all the possible culprits, and they rank them from the most dangerous and likely all the way down to the most benign.
And right at the top of that suspect list, you'll find these guys, the most wanted list. These are the really bad actors, the life-threatening conditions that need to be dealt with now. Things like appendicitis, a blocked-up bowel, a perforated ulcer, or even a ruptured aneurysm. So, and this is the key part, everything that happens next, it's all designed to either confirm or rule out these top suspects, and to do it fast.
Okay, so now it's time to call in the forensics team. Our detective has a solid list of suspects, but hunches aren't enough. They need hard evidence, and that's where lab tests and imaging come into play. This is what turns suspicion into proof. And just like a real crime scene investigation, this isn't random. It follows a very logical workflow. You start with the simple stuff first, quick bedside tests. Then you move on to more detailed lab work, blood, urine, looking for hidden signs of infection or inflammation. And only then, based on all the evidence you've gathered so far, does the detective order the big guns, targeted imaging, to get an actual look inside the crime scene. And of course, choosing the right tool for the job is absolutely key. An ultrasound, for example, uses sound waves, so there's no radiation, and it's fantastic for getting a good look at specific things, like the gallbladder or kidneys. But if the pain is more generalized, or if you suspect something really serious like a blockage or a tear, that's when you call for a CT scan. It gives you this incredibly detailed 3D map of everything that's going on in there.
All right, this is it. All the evidence is in. We've got the patient story, the exam findings, the lab results, the forensic scans. It's all been leading up to this one moment, the final verdict. It's time for the doctor to make the most critical call of the entire investigation. Because really, this whole entire process, all of that detective work, it boils down to this one single question. Do we need to go to surgery right now, or is it safe to wait, to observe, and to gather more information?
And this decision, it's not a gut feeling or a guess, it is based on cold, hard evidence. So on one hand, if you've got clear signs of peritonitis, that rigid abdomen we talked about, or hard evidence of a blockage or a tear, or the patient's vital signs are unstable, all of those things scream, we need to operate now. But on the other hand, if the pain is pretty mild, the patient is stable, and the tests are still kind of inconclusive, then the right call might be to observe them very closely. It's a calculated decision, all about weighing the evidence.
And really, this quote from a clinical guideline pretty much sums up the entire philosophy here. It says, when in doubt, involve surgery early. Because the stakes are just too high. You have to err on the side of caution, because delaying a diagnosis can have serious consequences.
Okay, so let's recap. What are the key takeaways from our little investigation here? First, a doctor's evaluation is a super structured, logical process. It's not just random guessing. It all starts with listening to the story the pain tells. They're always on the lookout for those red flags that signal an emergency. They use labs and imaging to confirm their suspicions, not to form them. And the number one goal always is to find that dangerous acute abdomen that might be hiding among all the other, less serious causes.
And all this leaves us with one final thought to chew on. Now that you've seen how this whole detective process works from the inside, think about it. How can you be a better witness in your own case? The next time you have a problem, what are the specific clues you could give your doctor? You know, thinking about exactly when it started, what it really feels like, where it is, if it moves. The clearer you are, the faster you can help them solve your mystery.